Hi, I'm Jackie. I'm the ED clinical pharmacist, and today I want to talk to you guys about the epinephrine shortage and how we're managing it from a pharmacy standpoint and how we should manage it during a code situation. Epinephrine, as you're used to seeing in the code cart, looks like this. It comes in a 1 milligram per 10 ml abboject, so it's pre-mixed syringe. This is on manufacturer back order, so the manufacturer is not delivering these, and we have nothing now for the code cart. So in order to fix this, what we did was we created these little bags, and the bags have all of the ingredients and supplies needed in order to make the abbojects, okay? So I want you to be aware when you open the code cart, you're no longer going to see these abbojects, and you'll see these bags. So watch this video and try and become familiar with the process, because the bags are a couple extra steps than you're used to just whipping out the pre-mixed syringe. So I'll go through the contents of the bag and how to make it. So hopefully you can take that with you and be prepared for your next code. The contents of the bag start with an instruction sheet. So this has all of the contents in the bag, and it also has the instructions on how to mix it. So you should know going in how to mix it, but in case you forget, this is helpful for reference. Then you have your medications. So the epi comes in an ampule, so it's a glass ampule, 1 milligram per 1 ml. So this is what has to be diluted in order to create that abboject. So we also supply the diluent. The diluent is a 10 ml vial of 0.9% sodium chloride. So this is normal saline. You're going to mix these in order to make that final concentration of 1 milligram in epi per 10 mLs. The rest of the contents of the bag are supplies. So you have your 10 ml syringe, you have your 18 gauge needle, you have a filter straw. Filter straws are needed for drawing medication out of an ampule. The reason for that is because the ampule is glass and it can get glass particles in there, and we don't want to get them in the syringe. So that will be for drawing up the medication from the ampule. And you also have alcohol swabs. Okay, so now I'm going to go over how to mix the medication. So I'm going to face the camera downward so that you can see a little better. I'll put on gloves. You normally should have gloves on during a code situation. And what you're going to do is you are going to start by drawing up 9 mLs of the sodium chloride in the 10 ml syringe. The reason you only do 9 mLs is because you're saving that last ml to fill with epinephrine, so that your final concentration is 1 milligram in 10 mLs. So you have your 10 cc syringe, your 18 gauge needle, and then just like you would any other medication, you're going to draw up 9 ml, so not the full vial. Okay. And there is our 9 mLs. Now you're going to move the sodium chloride to the side. You're done with it. There should be 1 ml left in that. Now you have a 9 ml syringe with sodium chloride in it. Next, we're going to do the ampule. So the ampule is a little tricky. So it's glass, so you want to be careful with it. Don't be too aggressive because it can be fragile. One thing to note about the ampule is sometimes drug can get stuck in the top of the ampule. In order to fix that, you just tap the side, and the drug goes away. As you can see, it went down to the bottom of the ampule. And that's what you want, because you want the drug in the bottom, because you're going to break off the top. Another thing to note is there's a small ring around the top. That shows the weakest part of the glass. So that's where you want to break. So you take your alcohol swab, and you are going to wrap it around the top of the ampule, as you can see. And you're going to point it away from your body and break. Again, it'll come off nice and easy for you, not too much pressure. Next, what you want to do is draw the medication into your syringe. In order to do this, you're going to use your filter straw. So like we talked about before, this is for drawing out of the ampule to protect from glass particles getting in. As you can see, it's malleable little straw, and you can turn your epi upside down. It won't fall out of the ampule, to note. Enter the filter needle and draw up your final ml of epinephrine. So make sure you get all the drug so that your final concentration is 1 milligram of epi per 10 mLs. Okay? And your final step after you're done mixing is you are going to write a label for it. So there are also labels in the bag, and you're going to make sure you write the name of the drug, and you're going to write the concentration, which is 1 milligram per 10 mLs, and label it, and when the next time the drug is due, that is when you will hand it to the nurse administering medications, or if you're the nurse, you're administering it. So again, although it's a couple extra steps, this is essentially the same as this, okay? So I wanted to go through that just so that when you open the code cart next time, you're fully prepared, you understand what these bags are, and you're not thrown for a loop, and that you're ready to prepare this in order to help better patient care. Thanks, have a good day.